Hi, I'm Dr. Liza Capiendo.
I'm Dr. Iman Faruzmand.
And I'm Dr. Gary Hoffman. We are colon and rectal surgeons with Los Angeles Colon and Rectal Surgical Associates in Beverly Hills, California, and at Cedars-Sinai Medical Center.
This is what to expect when you have a colonoscopy scheduled. First of all, you have to clean out your colon. That's the most important. Otherwise, I can't see anything. The day before, you're on a clear liquid diet, 24 hours prior, which means anything they can see through. Then later on that evening, you're going to be drinking a prescription liquid that's sent to your pharmacy. That cleans you out. So make sure you're at home when you're drinking this. Don't be at the mall, don't be driving, because sometimes it can work in 30 minutes. Some people, it can take a couple hours, which is normal. Try to finish your prep before midnight, because as of midnight, typically, we want your stomach empty, so nothing to eat or drink after midnight, including chewing gum, drinking water, eating breakfast, coffee. Those are all things to avoid after midnight. Then you'll be given directions where to show up. It's usually done at a surgical center. So a surgical center is where we do these procedures under sedation. You show up to the center, show up early on time, usually an hour ahead. The nurses check you in, they put an IV in your vein, usually in your arm or your hand. I'll be there. I'll be wanting to talk to you before and after. And then you'll be speaking to the team, the nurse that's going to be in the room, the anesthesiologist that's going to be sedating you. They are very important because I want you to be nicely sedated and comfortable. I don't want you to be wiggling around or in pain or uncomfortable, because that runs the risk of injury to the colon. The procedure typically takes about 30 minutes, 30 to 40 minutes, depending on how many polyps I see. If I see a polyp during the procedure, I'll be removing it with a special instrument that goes to the scope. It goes to the lab, it takes a few days to be processed, and then I usually will call you back with the results. After the procedure, you're in the recovery area. I talk to you before you go home, you get dressed, but someone has to pick you up. It cannot be Uber or Lyft, it has to be someone that knows you. The nurse will not release you to a stranger, so it has to be someone that can make sure you get home safely. And that's typically what's involved with a colonoscopy. It should not hurt. At the most, you might feel a little sleepy, a little groggy that day. You should not drive that day, obviously, but the next day you should be fine. And that's what's involved. It will save your life.